Good morning. I just want to let you know you're currently sedated, so if you feel just a little bit weird, that's why. It's okay that you're not completely under. It's totally fine. You can fall asleep if you want. You don't have to. I'm going to gently move your head up so that I have a little better access to your ears. So just set you like that, okay? We're going to start your ear surgery with a thorough ear cleaning because we are using a new technology. It is an injectable. It's important that there is no debris, no wax, no bacteria in the area. So we're going to thoroughly clean your ears before we do the actual shaping, okay? Hildy, I need, yes, the number 2. And if you could get that 25 milliliter one ready. This is a totally new surgery that you haven't assisted for before, so I kind of want to show you how to go through it. Don't worry, I've done it several times. You don't need to be nervous. Okay, so I'm going to start over here, and we're just going to pull all the wax out of your ear and make sure that the outside of it is squeaky clean. Yes, so you know that before we were like grafting on new bits of skin. Now we have an injectable fluid to help shape the ear. It's a little less damaging. It has less recovery time. It only works for one type, which obviously is what our patient wants. But we're hoping that we can develop more fluids, more types for different kinds of shapes of ears, okay? Yeah. Number 3, please. Just a little. Okay. We do have to inject like into the ear some, which is why I'm being pretty thorough there. Yeah, so it starts with the ear cleaning, and then we use, is this the 25? No, okay. Yeah, the other one. It's just a couple tiny, well, when I say a couple, there's quite a few. But it does a lot less damage than the actual grafting was before. And it creates it without any real scarring. Number 4 again, please. It is in development, and our patient is aware that it is a newer technology. There's very little risk now. And we have a bit of a guarantee, like a money-back guarantee. So if it doesn't work, there should be no harm, no foul. So yeah, I'm gonna need these ones filled up with that over there, okay? And if you could prep the iodine. Thank you, Hildy. This is her first time assisting on this one. So it's a little, she doesn't quite know what to do yet. But I got you, don't worry. You're going to have those beautiful ears you've always wanted. Okay, 2 again. Well, because there's no actual, it's all done with injections. The patient doesn't even need to be put under. We're going to use a topical anesthesia just so the injections don't hurt.
Can you get me the soft pick, please?
Probably the 3. Yeah, like in the 2 maybe. Thank you.
Just get that out.
So we do a couple right inside here.
But most of them are going to be on the other side because, you know, they want the ear shaping outside of the ear. Obviously, most people don't care what the inside of their ears look like.
Yeah, I'll need quite a few of them. You'll need to keep them coming. Fill them up all the way. Well, no. If you do the big ones, each one is just supposed to be 0.3, okay? Yeah, so just keep handing them to me when we get to that part. Because we just go one after another. Yeah, if you could.
I want to do probably a wash and the iodine. I'm noticing just some like older skin that we're going to need to take care of.
Okay. Let me check. So you had an inspection. Well, I probably shouldn't talk to them there. Twilight State, I'll let you know. They had an inspection. They should have had an inspection before. Can't be done if there's any lesions or bruising. So totally healthy and undamaged ears. You have to delay the surgery. Well, it's not even surgery. Delay the injections until a later date, if that is the case. Can you move the... There we go. Yeah, I'm just having a little trouble reaching it. There we go. Okay. So yeah, you're seeing the injections are going to go right here because they're shaping. So, okay, come down here with me. You're doing great. Right here, you want the injections where we want the shaping. So there's 2 different kinds. There's the kind that reduces, and then there's the kind that's going to increase. So you put them, because they want a pointed part right here. We're going to do some of the injections here. But to compensate for the pointed part, we want to tuck in right here along the outer helix. So, right. So this one, we'll use this one. Okay, how much is this one? Okay, yeah. I'm sorry, I was completely off base. Sometimes I get the milliliters mixed up with the point ones. You know me, healthy. Okay. So, need the wipe first. Okay. So we just start by cleansing, and then we're going to use the iodine. So it's really important that the injection sites are clean, obviously, but especially right around here, because a lot of ears tend to not get exfoliated very much. You want to make sure that when you're doing the injection, none of the skin goes in like dirty old skin. So, yeah. You know these things, but I can't help but explain myself constantly. Okay. A little bit more, also, if you would.
Here. Make sure that you get all the inside and all the crevices there. Alright, and second one, please. This one's getting to me. Right, well, we'll need to prep a little bit more. Give me the plastic one, if you would. Hold it, yeah, just hold on to it for me for a second. Thank you. Now sometimes I just get slow with it because the patient will look so sleepy. Don't want to wake them. Yeah, I'll do the applicator that way. Okay, so iodine, please. And then we'll pretty much just rub that all around. Yeah, it'll be all over. I generally like to tap them for a couple of minutes. With the anesthetic. Yeah. Well, we're hoping to be able to use this method for the goblin type ones too. Right now we can only do the elf ones and only the like really small ones because there's not enough like growth for the people that want the really long ones, the pointy ones. That one and yep, you know. You haven't even done this one and you know. That's a good thing that you can read my mind because I'm terrible at communicating when I'm doing the action. Okay. Yes, a little bit of the tapping now. Thank you, thank you. This has the anesthetic on it, but the tapping also just helps loosen everything up. Make the actual injections a lot easier. They are going to need bandaging, regardless of not having. We use a specialized. It's almost like a cast. Helps it stay in the form that they want because, like freeform, if we went freeform right after the surgery, it would kind of No. So we cast it. Let me see if I don't know. Yeah, that's what that weird looking thing is. They only have to wear it for a day or two. It sets in, but okay. It should be numbed up now. Do the other side, and then we'll do just a little test to make sure that they're all numbed up. Oh, I know. I don't know why they haven't gotten the better tables yet. My back is killing me. These short chairs, ridiculous. I know, it smells awful. I don't know why we've been using this kind. No, I don't think it does. The old kind we had smelled great and it worked really well. Probably won't get sold it. Yeah, or like we have a deal with the brand. Ugh. Okay. Just gonna do a little poke test, okay? They're still awake, yeah. Yeah, I'm just checking to see if they react. I don't wanna. Their eyes are closed, so I don't wanna. They're not reacting at all, so. Okay. Alright, you ready for this? Okay. Yep. Yeah, just keep them coming, alright? I'm just gonna put this. Okay. Thank you. Yeah, it's okay. There's no rush, but okay, we're gonna do the ones on the inside. Okay. Just get these inner ear ones, and you have to be so careful because I don't want to damage any of the. Ugh. Okay. It's really very little. You wouldn't want to overload it with. Yeah. That's why we're using the really small one. Yeah, get rid of that. And I think we need a little less for these ones. Okay. Yep, you're doing great. It does. It seems super wasteful. But that's the way it is. You use when it's done. Okay.
Okay.
Do that. Yeah, because it's not actual surgery, as soon as you learn how to do it, you're going to be able to. Yeah, I need the other kind now. The smaller one. I know, it gets out of control. I'm just going to hold their head a little bit here. They're kind of lolling to the side. Right there. I'll do the inner ones. I need to get the there. That one always makes me nervous. Okay, we need to switch to the other one. Yeah, let me. What, this is the 3 milliliter one? I don't know about that one. Okay. We're going to go back to the other one and do the reverse ones. Okay. Okay. Yeah, I need to be a lot carefuler with them. I think so. Okay. they're doing fine. I know it seems like a lot, but it's really, it's a lot less severe than doing the actual surgery. Yeah, it's already taking shape, but you do need to put the cast on it, so. Other side, I need like 8 of those prepped. Okay, thank you. Oddly enough, it's not super precise, which makes it pretty easy to perform. Yeah, we're almost done. We need like 3 more. Yeah, 1 more. Okay, that is it. Can you just hand me the whole thing? I don't. Okay, so cast for the left ear, please. Yeah, so we're just attaching it, and we need to make sure that all of the skin adheres to where it is on the cast. It's honestly kind of artistic. So this part especially, right up here, when you do this yourself, because we're getting a lot of orders for this, so we're gonna need every hand on deck here. So you want to make sure that the new tip is adhering to the cast up here, and that's going to keep it solidly formed till the cast comes off. Like generally 48 hours is what we suggest, but people are taking them off in 24. It's being fine. So we're just adhering the cast to every part of the skin. It's a little bit sticky. Well, we've already got you working on some of the surgical ones. You're pretty much almost complete by yourself, so this should be an absolute cakewalk comparatively. It can seem a little daunting with how many of the injections you have to do, but like I said, they're not as precise as you think they are. Well, the assistant had already, like you see where so in this ear, there was, some ink, skin safe ink, and every injection site was marked. Yeah, I mean, you can do that yourself, but generally the prep assistant's going to do that for you. And it's okay if you miss the mark a little bit. It tends to be just fine. Yeah, I do have to do some hand shaping. Yeah, totally. Well, I have Wednesday off. Wednesday and Thursday this week, which is pretty exciting. So yeah, but when I'm back in on Friday, we have one scheduled for Miller. So, I don't know who the patient is, but if you want to take the lead on that one, yeah, absolutely. Yeah, and I can assist, and it'll be, yeah, okay, fine, you can order me around. Okay. Now we just do the hand molding part. Yeah, well, I'm going around the cast and making sure the whole ear is adhered. So you're kind of just feeling where the cast is, making sure there's not an air pocket. See, because so they harden in a matter of like 45 minutes, which is why we're kind of speed working it. And you want to make sure that it's adhered before it hardens. So we're kind of just pressing a little bit into it. And the cast is it looks fairly similar to what the ears actually look like. Just a little oddly fabric-like. Yeah, if you want to go, actually, I'm pretty much done here. I will clean up. We got to get all this removed and into the medical waste and clean up the tools, but I can take care of it. I don't have another surgery after this for a while. Oh yeah, that's no problem at all. You can take off if you want. Okay. Bye, Hildy. I'll see you on Friday, okay? Yeah. Okay. That's looking good. Patient has the room for a little bit after this. Just going to quietly so that I don't wake them. Get my tools put away. I don't even know why we have these ones. It's so agitating. Oh, that would make it a lot easier. Silly me. Not that one. Maybe. I mean, that might work. Doesn't really. Ugh. I really should have kept all those. That one goes here. And just make sure your ears are okay, good. All right. Well, if you're actually awake, go and stay here as long as you like. I'm just tidying up. And I'll be out of your hair.